lazima utaanguka nayo and say something. So at the very onset, I would like to commend NTA for bringing us together as tobacco control advocates to address the challenges relating to tobacco use in Kenya. And I wish to point out something which is a sort of bad news from our studies that we shared 2 years ago, 2022. Unfortunately, tobacco prevalence rose by 0.2% from the year 2017, from 8.3% to 8.5%. So of all the drugs that we assessed in 2022, only 2 drugs were affected in terms of prevalence: cannabis and tobacco. With regards to alcohol, consumption has gone down. With regards to heroin and cocaine use, consumption has gone down. But as far as tobacco is concerned, the prevalence seems to be going up. So this clearly tells us that we have our work cut out as tobacco control advocates. For us at NACADA, part of the reason why we are really interested in tobacco issues is because we know it's a gateway drug. And young people end up using hard drugs once they have started to use soft substances such as alcohol and tobacco. So for us, this is a high priority issue, and we've adopted a whole of society approach in addressing this problem. So within our board, for example, and I was sharing this with Madam Odero from NTA, we have a representative of the youth, we have a representative from the faith-based organizations, both the Muslim faith and Christian faith. We have representatives from various institutions in government, and this is in the spirit of addressing this issue as a whole of society rather than one institution addressing the same. With regards to the novel nicotine products, it's essential that we strengthen the regulatory framework for the same. And within government particularly, and I was very scared to speak after Mr. Gitali, because every time we have in these forums, he always knows where to step with regards to government and some of the areas that we need to pull up our socks. So within government, we are strongly advocating for policy coherence as far as addressing the novel nicotine products are concerned. And as we tackle this emerging concern, it's crucial for us to remember that we need to address this from a public health concern rather than addressing it from a social interest perspective. So as an institution, we are here to learn from you. We are here to get feedback on some of the areas that we also need to improve on. And we look forward to the productive discussions ahead and wish everyone the very best throughout the conference.